If you've ever been told your brain MRI is normal, or this is just stress, or maybe you're just getting older, yet you still don't feel like yourself, well, this video is for you. Today, I want to talk about my biggest frustration with conventional brain care, not as an attack on doctors, but as an honest explanation of why so many people with brain fog, memory issues, anxiety, fatigue, or cognitive decline feel dismissed and stuck. Because here's the truth. Most people don't have a brain problem. They have a brain and body disconnection problem. And that disconnect is costing people years of clarity, confidence, and quality of life. Let me be clear. Conventional medicine, neurology, is excellent at crisis care. If you're having a stroke, a tumor, multiple sclerosis, seizure disorder, modern medicine saves lives, period. Not a debate. The problem starts when someone walks in saying, I just can't really think clearly anymore, or, something feels off my memory. I'm anxious, exhausted, kind of foggy. I don't feel like myself. And if the system asks only one question, is there something structurally wrong with your brain? If the MRI is clean, if the labs fall in the, normal range, the conversation often stops there. Here's my biggest frustration. Conventional brain care treats systems in isolation. Brain fog? Try a stimulant. Anxiety? How about an SSRI? Poor sleep? Some melatonin. Memory concerns? Well, let's just, wait and see. But rarely does someone actually ask, why is the brain struggling? What's driving the inflammation? What's happening with the blood sugar or the hormones, gut health, toxins? Maybe there's been past head injuries or chronic stress. The brain does not exist in a vacuum. It's an energy-hungry, inflammation-sensitive, hormone-responsive organ that depends on what's happening everywhere else in the body. When you ignore what's, factoring in to the brain, you miss the causes. One of the very most confusing things for patients is being told everything looks normal. But normal doesn't feel normal. Most standard tests look for disease and not dysfunction, not early warning signs or patterns. But someone can have blood pressure swings, they can have blood sugar swings, neuroinflammation, hormone shifts, sometimes even just, bad circulation and blood flow to the brain, and even yet still be told, you're fine. Meanwhile, they feel anything but fine. And then this creates self-doubt. People start thinking, is this all in my head? Well, it's not. Your brain is communicating. It's just a language that the system isn't trained to hear. Here's the reframe that I wish more people understood. The brain is a reflection of the body's environment. When I look at the brain systems, I don't ask what pill fits the symptoms. I ask what's inflaming the nervous system, what's starving the brain of fuel, what's overloading detox. Because brain fog is often a metabolic issue, a hormone issue, a gut issue, a stress issue, or a combination of all of them. But I'm here to tell you that you are not broken. Your brain is responding exactly as it's designed to protect you. Most of the people that I work with aren't looking for miracles. They're looking for understanding, context, a plan, hope. But the conventional system is time restricted, insurance driven, protocol based, and that doesn't leave a lot of room for individuality or pattern recognition. So people leave appointments with more prescriptions, fewer answers, and a growing sense that no one is listening. And that's not because practitioners don't care, it's because the model isn't built for complexity. So if you're dealing with brain fog, memory changes, anxiety, mental fatigue, and you've been told that everything is normal, I want you to hear this clearly. Your symptoms are real and they have a cause, and they deserve investigation, not dismissal. If you want to learn how a root cause integrative approach looks at brain health, one that connects metabolism, inflammation, hormones, and all the other factors that go into nervous system health, comment brain below or check the link in the description and I'll share where to start. And if this video resonated, subscribe because we need better conversations around brain health.